Good morning, guys. Today is the 2nd of March, 2021. We're going to be discussing a little bit about what happens in our office. Now, specifically, what we're focusing on is talking about what the clinical experience is when we come to our office and what people can expect. What we're proud of is we try to get a dynamics to understand exactly what is wrong with each individual patient. As you guys know, we run a functional medicine, functional wellness type of practice where we focus on the dynamics of injuries, primarily soft tissue injuries. But as part of this functional wellness dynamics and that's changing the world, we have to consider other areas. So many times when I have a particular patient, we discuss issues such as a back injury, but we have what we call maybe a clinically obese individual or an individual with diabetes or a person with metabolic syndrome. In that situation, my team here, Ana Paola Rodriguez Arciniega, who is a master clinical nutritionist, and we have Kennedy Vaughn, who is a health coach here, who is my team. What we're going to be discussing is actually what people experience when they present to an office, right? So one of the first things is once people come in, there's not only a moment of time where we take down that clinical history, but we have to assess what is this that is going on in this particular individual's life beyond not only the present ailment, which is particularly a biomechanical issue, a structural issue, but what is it that is also influencing these dynamics such as chronic inflammation, joint problem, autoimmune disease, neurodegenerative disorders. And we have to kind of put it together because the world of saying, you know what, that's not my job, that's not my issue, you have to go to an internist is short-sighted, but it is required because there are times when people do need that. And most of the times I do refer, but in the meantime, we're going to try to connect the dots of what an internist would do as well as a neurologist would do if that's what's the situation, or an orthopedist. Now, as a primary care doctor, what my job is to do is to know the difference of what belongs in the practice and connect what we treat along with other ancillary professionals. Now, we have a lot of great doctors out here in this particular community. And what we want to do is we want to discuss how we interact in the questionnaire component of that. So today, Ana Paola is going to be initially talking about what we call is the living matrix, correct? Is that Ana? Is that correct?
Yes, we're going to talk about the living matrix.
We're going to be discussing the living matrix. We're also going to be discussing the body composition dynamics, which is the in-body. And thirdly, we're also going to be talking about the portal of how we accept information with our patients through today's techniques. Now, what has happened in modern medicine today is we no longer can see our patients as much. So a lot has to be mitigated or treated through online services, right? So what we need to do is to give people a little bit of insights as to how we wrap around the patient in the virtual world as well as present it to a clinic experience too, because many times there's a lot going on that cannot be handled in a practice, like a detailed history, clinical nutrition background, organizing certain laboratory tests, but we can do that if we're connected to you in this format here and you have a team wrapped around you. So Ana Paola, go ahead and share your screen, and I'll start talking as you share your screen about what they're seeing, and then I can work you into that. So, well, the dynamic history that we take is real complex, and many times it requires you to be away from a clinic to fill out these deep questionnaires. Now, in these deep questionnaires, what you'll see is a complex series of questions. When people present to us, they present to us like an individual, that with a story. Now, sometimes the story may be really, let's say, verbalized to us in a form of subjective and objective complaints. But what we try to do in this dynamics is we try to teach people what is actually going on in terms of the long history. Now, in the long history, with seeing what is going on before, after, and during the particular episodes, we can also see the dynamics of a presentation that is, I think you have to share, you have to pick the picture on the file and then share it, Ana. And then from there, what we do is we can look at where this problem began. Not only, let's say we have an individual with a back problem, but with chronic fibromyalgia. We want to find out what has led to these topics or these issues with a particular dynamics. What we have here is a presentation, then I'll kind of put it in for Kennedy Vaughn, where you're seeing our history that we evaluate a person. Now, we have an app, a phone app under Dr. J Today app that you can find it on Android and on Apple that allows us to be insightful as to what's going on to patients. Go ahead, Kenna, tell us a little bit about this.
Yes, so Coach Care is one of my favorite things to do with patients because it really lets us track all of their progress as well as send them documents. So we're able to give them a lot of resources that help them with whatever diet they're on or lifestyle changes that they're currently trying to make. There's many different resources that work with Coach Care, not only just a scale, but we also can track their movements, and we can track now their blood sugars, even their blood pressure. And all of this information gets uploaded to their very own portal. So this is just a snapshot of what we can see in one of our patients. The scale allows us to see their weight change. But the thing that we like about this weight change is you can see right here, not only is it just their weight, but you can see the percentage that was actually body fat and the percentage that was lean muscle change.
Okay. So let me ask you this question. And Anna, you can answer this too while you're there. Anna, because you're the nutritionist, just keeping that screen on, and you can kind of like just keep the screen on. Anna, tell us a little bit about how you use the Coach Care app.
Well, something that is very useful about the Coach Care app is that it allows us to know what the patient is doing in order to get where he or she wants to go. So just by looking at these numbers, we are able to see if the patient will need like a different dietary approach, or should we keep the same? Will we give them like a little bit of more time for he or she to get to the health goals that they are looking for? So that is particularly one of the most important things about Coach Care. The other thing that I find that it's very useful is that it's a good way of motivation. It's like self-motivating to see your numbers either going up or going down, because sometimes people like to see like an extra weight change here in the lean mass muscle and the lean body mass. So I think that it's really important. I think that for motivation and monitoring, Coach Care is very important.
In terms of, let me ask you this: when a patient presents with this Coach Care app, Kenna mentioned that we can measure blood glucose, body fat, along with things like blood pressure. What's your experience with seeing, for example, in my situation, you saw that there was a lot of variation in my blood pressure throughout the day. This technology works with Bluetooth, by the way. Bottom line is you just turn on your phone and you step on the scale. We provide you with scales. We provide you with the blood pressure cuffs systems where it just turned on. And actually, we're going to be able to do not only blood glucose through simple non-intrusive ways. We can actually see blood glucose, but we can also tell the ketones that are being produced. Now, the ketones, as we know, are a product of fat metabolism. So sometimes in a diet, we have to adapt the change in the diet. So what I mean by that is that maybe our diet works to a certain point, but the body's smarter, way smarter than we are. So as it adapts, tell us what things we look for when a body is being kind of resistant to, let's say, weight loss in a dynamics.
Well, for example, you were talking about ketones and measuring ketones. So that is like very important if we want to lose weight. There's like this particular, you were talking specifically about the level.
Yes.
So that is like I think it's like the best way to possibly do that, because there's like multiple ways that you can measure your ketones. You can either use blood, or draw blood from your body, which I think that nobody likes that. You can take the urine samples in order for you to know if you're having like a right ketosis range, or you can use the level application that will actually tell us how your ketone levels are just by taking a deep breath and just exhaling. So in the number of the parts per million of ketone bodies that you have in your breath, you will be able to know if you are going to lose weight, or you're just like in a plateau. And that's like the kind of thing that people just don't want to be on. Like a plateau is nothing good. So that will be like a good measurement for us to know, like, okay, you're not like producing enough ketones for us to get like that goal weight that you want to be on. So let's do this dietary change. Let's try, maybe we can try fasting. We can try a lot of things. And that way we can produce like a right change for our patients instead of like wasting time, because I think that time is like the most important thing for our patients in order for them to get to their goals. So I think that's like the right word. You want to get them to their goal in a time frame that they are able to accept. So I think that could be like a very useful tool.
Okay, so let me ask you this. When I have a patient, and I do this every single time, when I have a patient, let's say that is having not only chronic pain, knee pain, joint pain, and by the mere fact that they've had it a long time, they haven't been able to work a lot. When I refer them over to you and we work in the team, so they're going to be asked some questions. Tell us a little bit about how you break down and you go through a nutritional assessment using the types of things that we have available.
Well, that's a very good question, because most of the time people or patients just go into your office and they are just like this. They're just thinking about one single symptom. And once they are in and they start opening up and talking a little bit more about how they are feeling, their symptoms are not only one, but there are kind of intertwined between them, and there are like multiple symptoms. So most of the time what I've came to see with my patients is that they have gastrointestinal symptoms. Maybe they are there because they want to lose weight because they are having extremely bad knee pain. They want to lose weight. But once you start going on with a nutritional interview, you can easily see that that patient is having gastrointestinal issues, or either something is not going good in their life. So you want to make the right questions. You want to make the patient accountable for what he or she is going through. So I think that will lead us directly to the lipid matrix assessment, which is like it's a large tool, but it's a very good tool. And I think that the most important thing about the lipid matrix is that once you're answering the questions, it makes you aware of what you are feeling. So that way
when you mentioned that about the living matrix, we're going to get into that in just a few moments, but the Coach Care app, as I want you guys to see, we have the ability to actually just dive into your phone. So now you have your doctor with you. The application is going to be able to not only take pictures of your food to be directly, the last thing we want to do is we have time. Anna was mentioning the time issues. No, just take a picture of the food. Okay. And if you may not want to take a picture if it's McDonald's, but still take the picture, because we can kind of come up with a kind of understanding as to what it is you do. So that makes it real simple. We can also schedule an appointment with you directly from there. And also you may have a question on certain types of foods, replacements, substitutions, all those kind of questions can be done on these portals. And we have a team here that can jump in, whether I'm with patients, they're going to be live and they can answer those questions live. So what the world has changed now, maybe you had to wait for your nutritionist to get a hold of you within the next visit, maybe a week or two, a month later. Mm-hmm. Now you have the same within a few moments where you can answer your questions and we can actually assess what's going on. I'm not too sure, Kenna, you have mentioned that, actually, I would like to see if Anna can actually try her.
I think I can.
You think you try? Go ahead and see if you can start sharing your screen, and then you take over and see if that shares your particular dynamics. And take us through what you do when you do a living matrix or a functional medicine assessment, which is different than a Coach Care app. The Coach Care app is the thing that keeps us in tune. But in terms of taking down your history, tell us a little bit about what goes on in times of the living matrix. I can see your screen there.
Oh, that's amazing. So first of all, the living matrix, as I said before, it's a it's a very good tool for the assessment of the functional medicine approach. So what I want to say about the living matrix is that the first time that you are going to see this, it's going to seem like a monster because it takes a lot of time, but it's like a very amazing tool because I feel that once you're answering this, you become aware of what is exactly going on. And it can actually, sometimes when you're in a conventional medicine, or, well, I would like to call it like a conventional nutritional consultation, you try to get like the feeling of your patient. You want to get to know him better. You want to get to know what is exactly the purpose that they are in your office, why they are in your office, what do they need, why are they here. So once you start going through the process of interviewing these patients, I can tell you now, I take a lot of time just by getting to know these patients and asking the right things. And sometimes the patients, because this is something very important, the patient should know what they are feeling and what they need. So the patient would start like maybe going through a tangent, and it's hard to get them back on. So this with the living matrix will actually be like a step closer to the right treatment that you want to have, because the patient will already know what the purpose of the consultation it is. So as you said before, sometimes the patient is going through some pain in their lower back area, but they are still having a lot of symptoms. So what I like about the living matrix is that it actually makes us like, the first thing that you want to know is the health goals of your patient. So the patient will be right here and writing down what they want to get out of your consultation. But you have another kind of sections of the living matrix. So the current health concerns will be like the second thing that you will be able to measure right here, and you're able to put like, okay, I have 2 more health concerns, and the health history and the lifestyle review. Something that we might want to look after are the antecedents of our patients. And I think that we've kind of vaguely touched on this before. There are like the things that kind of makes us a little bit more, it makes it easier for us to suffer of some things if we have the certain antecedents, like, okay, my delivery mode or my birth delivery mode was cesarean. Well, then that will actually be an antecedent for us to have like different kind of conditions or to develop some kind of risk of disease. So that will be like a very important part of the health history of my patient. And I have to admit that most of the times when I'm looking at an adult patient, I'm not thinking about how they were delivered to this world. Sometimes I just want to know why they are having that significant tummy ache that they are coming here from. So I'm sorry. So that is like a very important thing to know about your patient, because you're getting to the root cause of it all. So I think that this is really like a better way for the patient to reconsider all of the things that are going in their life in order for them to get to a specific condition that they are portraying at the given time.
You know, when you mentioned that, one of the things I get with my patients is that they appreciate the fact that they can actually do this at home at their own time. One of the things that I tell patients to do is find a little moment in time that you have probably between a half an hour to an hour to really, really analyze what you've gone through. And in the events of patients that have not only joint pain, but autoimmune, concomitant autoimmune disorders that are correlated or some sort of secondary impact such as in fibromyalgia, when we try to understand that, once you really sit down and see specifically, as you mentioned, lifestyle changes, the way that they grew up, the things, the toxic loads, what they call the antecedents, mediators. These all issues will present itself, and we can have a bigger picture, something that can't be done typically within an office. So we have a much deeper level of understanding as to what's presenting our patients. So they do appreciate that. When you have these patients do this, Anna, how do they feel after they finish the questionnaire?
After they finish the questionnaire, well, they actually just tell me like, hey, I just finished my live-in matrix and there you go. I can have it directly in my computer. And one thing is that I can go through it. And right before I get in front of these patients, or even if I'm having like this Zoom meeting or Zoom call with a patient, I feel like I already know them. I feel like I already know what they need from this consultation. So that is like really, just imagine that. I've never been to a doctor who has like stood in front of me and said like, I read your medical report. Like, and I'm like my father is a doctor and I've never had that experience. So just imagine what it is for a patient to have a healthcare practitioner that say to them like, okay, I know that you had this infection right before you came here. And I know that the main purpose of this consultation is because you have here. But wait, I've already seen your in-body results that we took in your previous consultation with Dr. Alex Jimenez. And I can tell you that I can link this finding right here and link it to the way that you're answering these questions right here. So that will be like an extra insight to the things that they are going through. So of course they feel like that they are like the center of the universe because that is their special time. They should feel that way. That's why you are here for them.
Yeah, I can assure you this, that by the time that you finish that, we not only know the direction that we need to take, at least at the beginning, our working treatment diagnosis is at least set forward at that moment. So for us, it's very important to be able to kind of come up with a deep history and coming up with that assessment. Now, you had mentioned in that process, you mentioned a little bit about the Coach Care app, and we've talked about a little bit about the Living Matrix, but tell us a little bit more about the Living Matrix, Anna, in terms of what you wanted to talk about.
Well, something that I particularly use a lot is the lifestyle review and the 3-day daily report. You know, that is like my favorite thing to do as a nutritionist, because that is like the things that take the most time of your nutritional consultation. And as I said before, sometimes when you're in a conventional mode consultation, you want to talk, and the patient is just right there looking at you like, so when is my time to talk? When am I going to say something that really is important for me? So that way I can previously see what they are eating, but maybe do like a quick calculation about their dietary intake or their caloric intake, maybe link it to the way that they answer some of these questions. Another thing that is so important to me is the fact that here in the Living Matrix, you're able to take pictures of your supplements and you can write how much is the dose that you're taking. So once you have that type of information, you can actually kind of give like a better information and kind of pave your way into like a better treatment for your patient. If they are already taking this type of vitamin D and they are feeling great with this one, but it's like a very low quality, then I can change it. But if they are taking this omega-3 fatty acid supplement, which is super great and it's like a very good dose, then okay, I might be able to use that time that I wanted to use to explain the action or the benefits of taking omega-3 fatty acids and use it to another thing of my particular treatment plan that I have for these patients. So that is really insightful. Another thing is that the medications or the supplements is like the easiest thing to forget. When you're a patient, most of the times you're not thinking about, okay, I take this antibiotic that is called this and that, and the dose is this and that. No, like no one knows about it. Like most of the times they just forget it, and they lose a lot of time while they are on your consultation, and time just runs out most of the time. So
that's an important point, Anna.
Yeah.
That one of the things is that when someone is within their own confines or their own comfortable environment, they remember a whole lot more. They do provide the information. I can't tell you countless of times when I have patients and they're looking at me and they're like, I forgot what I was going to ask you, or they just kind of like, it just slipped their mind. But later on, they wanted to add that. This is the ability for us to be able to be on the same stage. When we look at individuals, we look at not only their physical complaints, their health history, but we also look at their lifestyle review, okay, which I see you have there. Now,
yes, right here.
Yes, in terms of lifestyle review, tell us a little bit about what we look for to see what their environment is like, specifically with an individual that is presenting with symptoms.
Okay, well, the first thing that is very important for us to note is what type of lifestyle they are living. Sometimes they are, well, I can tell you something very easily. Most of the people just come to you and say, no, I just have like a normal lifestyle, and that's it. For them, their lifestyle is normal,
yeah.
but it's
Nothing's
not normal
now, huh?
for me. Yeah, nothing is normal now. So if I'm a patient and I'm getting like this report and it's saying like, okay, what is the average of number of hours of sleep per night? And I go like, okay, I watch Netflix from 11 p.m. to 1 a.m. and then I wake up at 5 a.m. Then you're like knowing, you're like producing this awareness that you are sleeping way less than you are supposed to be sleeping. So that this is like most of the time it's ignored by most of the physicians, or as a nutritionist, I'm guilty of this most of the time, as long as the patient doesn't mention IBS or colitis, something like that. But okay, once I start going through the sleep history and why they are doing this, if they are feeling stressed, if they are releasing cortisol or like elevated amounts of cortisol, then I know I have to take my treatments and lead it the other way. So this is like very good information. Another thing is exercise. Sometimes you only ask like, are you physically active or are you not? And what kind of activities do you do? Well, that is very important. Nutrition, as I said before, I'm a nutritionist. I'm like all around this. So this is like a very important thing to know, because most of the times we get highly educated people. So they know everything that it is around diet and around different types of dietary intake. So you want to know.
I want to mention something about that. You just mentioned that we have highly educated patients. I cannot tell you that the world hasn't changed. It is very different. When I started practicing in 1991, there was no internet. I got to tell you, in 1987, there was Prodigy, AOL. Today, we have extremely highly aware patients who have done their own research, that are walking in with armored knowledge or knowledge in their hand and in their brain, that they are smarter than 99% of the people out there in terms of their particular condition. So, but sometimes putting it together is the issue, the confusion of what we have. I think one of the most common things that I hear from my patient is the nutritional advice is confusion, and going through med schools and my clinical experience through all the teachings, it has changed. And it certainly is all footnoted throughout the internet in a confusing way. So what we try to do is to try to make sense of it and try to at least create order when it comes to a particular dynamics and nutritional need. In terms of that awareness, how do patients perceive how do you feel? And this may be better for Kenna, when patients ask you to go over their clinical records, and we have the entire history, not only from one doctor, but from all 10 doctors, 20 doctors, 30 doctors, or even just a single family doctor. How do they feel, Kenna, when you go over that information with them?
They feel heard. They feel like they're not wasting their time with just another doctor. I know it can be so frustrating for patients and people just in general when you don't feel good. It's exhausting and you're going through all of these steps to get yourself to feel better. And like Anna was saying, you just spend your whole appointment talking about something that could have been looked at previously. And so when we already have those medical records, we already have these assessments, and we sit down with them and we show them that we care, we're here for you, we've looked at all of these records, we want to talk to you about these next steps. It shows them that we're prepared and we're ready for them, and we're ready to make them feel better. We're not here to just waste your time. We're here to really help you change your life and your lifestyle. And so when we have all these forms, I think our patients really feel cared for, and they really feel heard and appreciated because their time is so valuable.
I think that today people want their information. I think that they want people to understand their information. And it's very difficult. As a matter of fact, one of the most common causes for poor diagnosis is not having a complete picture. And if what we do is, by the way, we provide you with your own portal, so all your stuff will be on there. And if you need, let's say, go to the Mayo Clinic, they have our history. And it's important to be able to provide other doctors in all different ancillary types of practices and clinical, dynamics to be able to upload this information in a very fast and quick way and not have to delay time. So the shortness of when we compile the information, we don't just compile it for ourselves. It's for you to be able to dynamically be able to present it to all your doctors to come up with a basic diagnosis. Now, I know you're looking at illnesses and conditions that we kind of correlate with, and we ask questions on it. Anna, tell us a little bit about what you're looking at there.
Well, I'm looking at the second. This is actually like the second part of the IFM consultation. As I said before, it's a long assessment, but it actually goes through all of the different conditions that you might be going through or actually went through. It asks you from what is starting date to the end date that you were feeling this particular condition, and you're able to make some comments about it. For example, I will use this to write about the medication that I was taking or the particular situation that made me go through a lot of stress that would eventually lead to irritable bowel syndrome. So that would be like in the comment section. But what I like about this is that it's actually separated in different sections. So you can have the respiratory section, the urinary genital section, the endocrine metabolic section, the inflammatory, the skin, cardiovascular, and so on. So it goes on and on with the different symptoms that you could have. And I think, as I said before, this is something very important for the patients to go through, because they will eventually become aware of, are they really feeling this bad, or is the main purpose of the consultation set in the right way, or are they actually there to look into something else that they didn't thought about before? So that is like
when you
something
say
very
that,
important.
I think that one of the things, if I may, Anna, is that when we basically hit you as a team, we're going to be shooting from different directions, and we're going to be finding as a team, as a unit, what we can figure out in terms of the big picture for a clinical presentation. It is not always obvious that a person with shoulder pain, mid back pain, low back pain, knee pain, inflammation, sometimes the correlation into their personal lifestyle from eating habits to prior past is not so obvious. What we need to do is we need to figure if it is related, and it is. I mean, sometimes it's real simple. You fell from a ladder, you fell and you broke your foot. It's obvious. However, many of the patients we deal with are chronic injuries and chronic traumas that are continuously plaguing the individual. We are able to kind of evaluate those systems, and we are able to do this in the right types of format. And taking the advantage of today's present dynamics, such as a COVID period, you know what we need is need the person's thoughts and figure out what happened so we can come up with the proper clinical experience. In terms of the experience with I know, Kenna, you're going to present right now the other part of the application, which is the anthropometric measurements at what we do. So are you able to share at this point? Yeah?
Yes.
Go ahead and share your screen, and then we'll come back to this one after, Anna. Good job. Thank you for explaining that. And we're going to be able to do this in a much more elaborate way. So now we're going to go ahead and we're going to take a look at the basics of understanding of where's your body at? How much inflammation do you have? How much? And we do that through lab tests. We do that through anthropometric measurements, which means we made a body composition. So, Kenna, tell us a little bit about what we see when we're dealing with individuals, specifically when we deal with body composition assessments. Here you see me. I guess that's me there. So, hey, HIPAA is okay. You can actually see what I'm made of, guys. So you can talk a little bit about what's going on in terms of just my own physiology. Tell me a little bit about what you see here.
Of course. So when we take a look at our patients' reports, this first page is very important to us because we can see right here this visceral fat area. Visceral fat is the fat that is surrounding your internal organs. The higher visceral fat percentage you have, the more susceptible you are to getting chronic health conditions. And usually that means that there might be something else going on in your body that we want to take a look at, whether it be metabolic syndrome or something along those lines where inflammation is definitely present. We see the line go straight across here at 100. This is kind of ideal. This is what we're looking for. We want our patients to be as close to 100 as possible. And so you can see right here, this patient's at 115. So not too far off, but we do want to work on getting it lower in order to improve their overall health. We can also take a look down here where we can see that it actually separates the fat into every single area in the body, which is so helpful. You can see what leg is bigger than the other leg. This could be muscle. Like I said, this could be fat. We can also take a look at that inflammation factor to see if one leg is bigger than the other. They might be having edema in that leg. There might be something else that we need to take a better look at. And so this test really allows us to do that. We usually do this test once every 8 weeks with our patients. That way we're able to keep a steady progress on them and, recheck that visceral fat, recheck if they're having edema and additional swelling, see if they've improved on their skeletal muscle mass. These things are all very, very important. And it also helps us make sure that the program that they're being put on is working for them. This gives us more than just their BMI. It really gives us a very detailed inside look.
When you kind of like to look at this particular situation with this particular individual, you can see that the right leg on the segmental fat analysis on the lower right-hand side, you can see that the right leg has a little bit more fat on it, okay, than the left leg. It's interesting because this particular happens to be myself. And I had a knee injury, and I've always made sure that I have to work that leg a little bit more. But you can actually see that the amount of a little bit adipose tissue on that leg is a little bit more than usual, specifically because a knee issue is present, and that is what we're dealing with. So the ability of the muscle to output and push more load is obviously seen here because you see a segmental body fat analysis increased a little bit on the right leg versus the left leg. Now that's a very minute amount of change, but 2% is something that can be calculable. Okay. Now, in terms of this, we're gonna use me as a case study here. You can see the visceral body fat. If you can go a little bit higher there, you see the body mass fat, right? A little bit lower, because you're kind of right where it says 20 pounds, 20.9 pounds I have to lose.
All right.
That's how much it's recommending that I lose in terms of that. Now, I'm at about 230. I know that may be a little bit far-fetched for me in terms of to try to go to, but if I met 15 pounds, I'd be at my optimal body weight. I've always known that 215 is where I feel the best, because I've seen what lean does, and lean is very, very good. Some of my athletes in this particular dynamics are at 0% request for fat body mass, at least to control it, to minimize. And this thing is very accurate. So this gives me a little good cadence as to between 15 to 20 pounds that I should lose. It really gives me the assistance. We measure these on a regular basis, primarily at minimum once every month to see the changes. My extreme athletes, they love this. So they want to see, specifically like wrestlers, people in agility sports, they want to see what changes, even any new adaptive change in their diet or their training mechanisms or the training platforms. Go ahead, keep on going. Tell us what else we see here on Kenna.
Yes. So another thing I just wanted to point out, you were talking about the leg injury. This is why it's very important that we have that detailed form from Living Matrix, because in that form, it asks you about previous injuries and previous things that have happened to you. And so this is just an example of how we can put those two reports together to really get down and figure out what's occurring in the body. If we just looked at this report, we might not have picked up right away that there was an injury. But when we pair that with the Living Matrix, it just really helps us complete that whole circle of really what's going on with our patient. And so that's just, like I said, an example of one of the reasons why we do all these different forms. If we go a little bit lower, we can see the basal metabolic rate right here. This is how many calories the patient would burn if they did absolutely nothing all day. In order to lose weight, generally you need to be in a caloric deficient state. And so we can use this number to help, Anna can use this number to help our patient really fine tune their diet and their eating habits. So that way they make sure they're getting enough nutrients to fuel their muscles, to continue to build muscle, but also to burn that fat. And so this is a super great way to see really how we can help our patient get maximal results when it comes to that nutrition side.
Let me ask you this. Just looking off that, I think my wife is trying to not use that number. That's 2,127 calories. So Anna, is it fair to say that one meatball is not enough for these guns, or what?
Don't tell her I said this, but it's not enough.
No. See, I'm telling you, I need to be fed. So I need some sancocho, some food, some steak or some meat, but based on the right thing. So it helps us also determine exactly where our diet should be. So a little bit of more information on here. I know that we do a little bit down. I think you can scroll it down or minimize it or make it bigger. I'm not too sure if you hit the bigger box. There's a little upper box up there, right? A little higher. Right there, that one. Okay, click on that one. When you look at that, let me see what happens there. See on that one, can you scroll down to a little bit more information where it actually gives the water content information?
Yes. We can see a small bit right here of the general body composition. Let me go ahead and go back to this.
Yes, we also, when we do this, a lot of times, in order to understand what is happening inside the body, we have to kind of go a little deeper, such as how much water is the cell retaining versus the outside. We're learning that modern medicine has determined that if cells leak their water, and it goes into what we call the interstitial cells or intracellular stuff, basically it's when we look bloated. So we need to keep the water within our cells to be hydrated. If it starts leaking out because we have inflammation, we can actually measure that here too as well. We'll go ahead and scroll to where you were going to.
Oh yes, right here. I have it pulled up. So we can take a look at the intracellular water is 81 and the extracellular water is 49. So we can see that there is more water inside of the cells than there is outside, as well as looking at the lean muscle mass and the body fat mass.
So here's a point where we can monitor the first point of measure, where we see the extracellular water. Now we have a point. We can now see if we change. So let's say my extracellular water started going to 52 pounds, 52.1 in that sense from a 49. We now will be able to notice it. And I can assure you my body will feel the bloatness, if that's a word, bloatness. So we can actually determine what's going on. So I'm very, very much aware that even though I may be in my top score of 91%, and clinically what we would call me is obese because I'm approaching 33 BMI, you can actually see that there's a lot of other components and explains why, going back to one of the main points, that BMI is not always the best thing to use to determine body composition. Though it's a start, it says that I am closer to clinically obese than a fit individual. However, the computer can actually, when we assess all the figures, it puts me in the 91 percentile. I like saying that, 91 percentile. Did I say 91 percentile? Okay, so anyway, so the point is that we can actually assess what's going on. Now, these are private, these are personal, and I got to be honest with you. Many times people don't want to have the knowledge. They just rather, you know, I got what I call is stick your head in the floor or in the hole like an ostrich. But this is quietly private, and you can now see what you got to do individually. Now, there's a number where we kind of go down there a little bit. It's called the phase angle. Can you kind of get that in there? And this is what the phase angle is kind of right there. You see it at 6.3. Now, what we've had is we've had experience to be able to assess that a phase angle typically in most patients are between a 5 and a 7. Now, 6.3 is okay, but we want to push better. We want to get active. Now, let's assume we can look, what is someone that looks like a 5 versus one person that is at a 7? The best example I can use is that if you compare it like a library, a scenario where people are quiet and they're not moving very much and very much at a slow cadence, that would be cellular activity where you have, let's say, taken a big test. You have, let's say, 60 people in a library, but they're all quiet. They're not supposed to talk to each other and they're being maintained at bay. That would be a 5. You take something to a 7, and then you'd be looking at something like a rave, like a dancing rave, where people are having much more energy, makes sense, and they're dancing, and it's a good amount of pulsing. What this is really telling us is the state of activity within all our cells. And the number is basically says, how ready is your body able to sustain a change? And how active is the metabolism going on and all? At this present time. So phase angle really gives us an insight. So if I start running and I start getting active, if I measured my phase angle not too long after that, it would be at a higher rate. But it's great to measure a resting phase angle because it tells you how ready is your body to be able to sustain. Now, I don't know if you can, but can you go to the is there the next page over? Can you see if you can get to the other report as you kind of have to kind of pull it down? And that may be under there it goes, the other page there on the right-hand side. So what we can do is many times we want to look at things such as the water composition. So in that sense, I know it's a little bit kind of iffy there, but it's actually, we're trying to look at the body water composition. So if you don't get, that's okay. It's no big deal. What we do is, if you can look on the right-hand side, you see that the second report is there. Go to InBody sheet on the second tier where it says InBody, and there's a little drop down right there. Right next to it says on the upper left-hand side, it says right there, there's a little drop down, yes, and go to water results. See if you can click on that and just let it pull up. In that sense, we can also see what the body fluid is. Now, as you scroll down here, it's a much deeper analysis of where we stand. Now, the goal here, extracellular body weight plus total body weight analysis, right in the mid-center of there, you'll see is a 0.37. Our goal is to get your physiology to a 0.370. So that's our goal of health. When we see that number inching up, we start noticing that there is an overall balance of too much water fluid inter versus outer cell. Okay. So just to make it look, once we assess this gives us a basic, what they call anthropometric measurement in terms of what's going on. So in review, today we've covered over not only, and we didn't cover the initial history where people come in talking about what particularly hurts, but we also talk about the additional areas through the living matrix that are affecting their particular lifestyle and or their family's dynamics. We learn a lot about their present situation. We use the Coach Care app to be able to discuss exactly what goes on with an individual and teach them how to start taking accountability in the information really easily. Because there's one thing we all have, and for sure, there isn't pretty much anyone that doesn't have one of these around them. So this is your best friend in terms of being able to recur information and pull it in so that we can see it. The team is going to be able to splice the information and pull medical records from all sorts of doctors and compile it so that we can start coming up with exactly what is it that's causing your fibromyalgia? What is it that's causing your secondary fibromyalgia to your primary, let's say, knee issues that do not resolve? We have to figure it out. And at that point, we can make a clinical decision as to which type of professions or which type of science is appropriate for you. You may need an internist. We may find out that we're the first people that find out that you have a kidney problem or you have an inflammatory autoimmune disorder. This is the kind of stuff that we do now to be able to assess the appropriate treatment program. Now, there's one component that we have, and Kenna, you do this as well. You're the one that organizes and orchestrates the dynamics of physical fitness and the training. So we have a training center where we work with a top physical fitness trainers to be able to start getting the body to move so that we can see the changes, not only in the diet, but in the anthropometric dynamics. So tell us a bit about what we do in terms of offering people the types of rehab that we do.
Yes, we work with a facility called Push Fitness, and they have so many great, and I don't even know what to say. There's 3 levels in this place. It's just amazing. They have something for every single body type, every single type of recovery, whether you're looking just to strengthen those joints and those stabilizing muscles around them, or if you're looking to reduce your visceral fat. And they have almost everything you can imagine with some of the greatest people working there.
When you mentioned the 3 floors, the way the facility is designed is that we take into account not only flexibility, agility, and mobility. Now, in most contemporary fitness centers, you'll have weights and machines, and I primarily say that those are limited to a few joints, such as a bench press is limited to your arms, upper body, squats, lower. And that's a contemporary or the old standard gym that we've been using for many, many years. However, when we're dealing with the type of gym we have, we also have a multi-joint dynamic area. People know this is agility, plyometrics, CrossFit type of exercises where you use the entire body. An example would be, let's say, a burpee, planking. You're using many, many joints at the same time. What we've learned is that the balance of multi-joint versus simple joints or maybe compound joints moving at the same time, the synergy of both is what's important in our body. Now, we will always be working with the cardiovascular system, but there's one component that sometimes is missed. It's the stretching, the flexibility. So the way we look at it in that facility is we look at first, we work on mobility, okay? Then we work on flexibility. And then ultimately, when we have become flexible enough or dynamic moving enough, then we can start doing agility. What happens many times is people jump from mobility to agility, and that would be something a weekend warrior does. Now, I am still 18 years old. No, I'm not. I'm 53 years old. However, my brain still thinks I'm 53 years old, right? So what happens is that when I decide to get under the whatever plank system, I still think I'm 18 years old, right? I am destined to probably get injured if I don't watch myself, right? So we have to have a normal migratory path from flexibility to mobility to then agility in a progressive way. Now, here's what's crazy about it, okay? Can a 90-year-old person do a CrossFit dynamic exercises? The answer is Yes, absolutely. However, we do different levels at different stages. I've seen things that are just amazing. For example, I've seen without really revealing more, we've seen people in their third trimester doing similar, obviously well-modified exercises while they're in their third trimester in a way that it benefits the birthing process. So not only do we take only singular movements, such as a curl, complex movement like let's say like a bench press, maybe more joints, but dynamic movements such as in a plank or in a mobility. But we must go back and we must figure out flexibility. We must work on an individual's ability to flex and mobilize their body appropriately. Now, that seems far away, but it is tied directly into disorders of fibromyalgia. We're dealing with autoimmune disorders. We're dealing with lupus. We're dealing with things like multiple sclerosis. This is a neurodegenerative disorder that benefits directly not only from nutrition, but exercise dynamics, right? So when we have a team working together, whether it be something as diabetes would be, exercise physiology will always be part of it. That's where Kenna comes in. What we're eating, how we're eating, how to adapt those things is where Ana Paola comes in, and we work as a team in order to make that. In order to figure out what we're doing, Kenna works directly with the personal trainers and the physical fitness, as well as physical therapists and assistants that are in that facility to be able to improve not only the mobility, but the life expectancy of an individual. Because what people won't tell you if you have bad anthropometric measurements, if you have limited mobility, if you have joint pain, that directly affects your life. Now, if you have issues with eating, well, you may not know that the reason that your body stays in an inflammatory state is because your body is in these dynamics. So as we deal with these particular recovery programs, we have to bring in a lot of clinical expertise and dynamics in order to come up with the proper treatment protocols. Now, that may be a little bit more than we planned on sharing today, but what I want you to know is that we are going to figure out what's going on, okay? We are going to not have the perfect answer in the beginning. We have the working history. From there, we will develop the working dynamics and test it and test it and test it so that we can actually make things work better. So in the overall process of wellness medicine, physical medicine, functional medicine, chiropractic, physical, dynamic, internal medicine, even the dynamics of working with all the other doctors, it requires a massive team effort. So one of the things that we do is we take advantage of the fact that we live in a very mobile world. It's a virtual world. And just like you can hear me talking, you too can have the individuals working with your anthropometric measurement tools so that we can basically come up with the treatment protocol and allow you and your family members to enjoy their lives. So I hope I've been a little bit aware in terms of the information that we have here to offer you. Is there anything else which you would like to add, Anna, at all before we go?
No, I just want to say that the same thing that you said before. It's very important for us to know what the patient is going through, because maybe we are like the first line that it's going to treat them, but eventually we would have to call either an internist or a cardiologist for them to cover the whole spectrum of the condition. So that is like very important. We're covering the lifestyle, we're recovering them for a very chronic condition, but there are like acute circumstances in those same conditions that should be treated by a medical specialist. And the thing is that we need to work hand in hand. We need to have this very specialized groups or specialized integrative medicine is what we want to do. Is we want to work together.
That's exactly what integrative medicine, as we are presenting it, is offering. In terms of, I totally agree with you, and well said, Anna. Kenna, is there anything you want to present there?
No, just that we're always here for our patients. And as you can see, we really wrap you around in every way that we can.
Sí se puede, sí se puede.
We're going to find it.
We're going to discover the issues, and if we can't, we're going to get the right people for you to be able to assess it. Thank you, guys, and I appreciate it. We'll be back next week to cover a little bit more topics in terms of wellness, integrated wellness, functional medicine, physical medicine, injuries and trauma that are all correlated, and more, so to speak. Okay, so thank you, and I appreciate you guys all. Have a great Tuesday and enjoy your day. Thank you, guys.